Today we will study about hypertension. In this lecture, here is the list of topics we will cover. First of all, we will study the definition of hypertension. What hypertension? After that, we will study about how many types of hypertension there are. Then we will see which factors increase the chances of having hypertension. That is the risk factors. After that, we will study about the pathophysiology of hypertension. Then we will study about the clinical features, which are the signs and symptoms. Then we will see how hypertension is diagnosed. After all these things, we will then look at its treatment, that is, management. How hypertension is managed. So let's start. First of all, we will see what hypertension is. Students, what hypertension is? It is a medical condition of our body in which the blood pressure of our body's arteries remains consistently high. It increases. So we call it hypertension. In common language, we also call hypertension high blood pressure. Here I will tell you one thing. Students, our body's normal blood pressure is 120 by 80. Now I will tell you something. Students, our blood pressure is measured in systolic and diastolic, and its unit is millimeters of mercury. There are two blood pressures. One is when the blood is pumped from our heart to the body, and one is when the blood returns from the body to the heart so that the heart can pump it back to the body. So, the blood that the body pumps back to the heart, we call it diastolic. And the blood that goes from the heart to the body, we call it systolic blood pressure. So the normal systolic blood pressure of our body is 120 and the diastolic blood pressure is 80. So whenever the systolic blood pressure of our body goes above 120 and the diastolic blood pressure goes above 80, we say that the person has hypertension. Now let's move to the types. There are four major types of hypertension. First, let's start with prehypertension. In this, the systolic blood pressure remains between 120 to 139 and the diastolic blood pressure remains between 80 to 89. So we say that this person has reached the prehypertension stage. If a person's blood pressure, the systolic blood pressure, is 140 to 159 and the diastolic blood pressure is 90 to 99, then we say that this person is a patient of hypertension stage 1. If someone's blood pressure goes above 160 systolic blood pressure and the diastolic blood pressure goes above 100, then we say that this person is a patient of hypertension stage 2. We have another category of blood pressure, which is pregnancy-induced hypertension. In this, what happens is that females who become pregnant, they experience a lot of hormonal changes in their bodies. When many hormones are produced in the body, it causes the blood pressure in the body to increase. So we call it pregnancy-induced hypertension. Now let's move to risk factors. These are the factors that if any one or more of them are present, the chances of getting hypertension increase significantly. The first risk factor is age. If someone's age is above 50 years, the chances of them getting hypertension increase. If someone consumes alcohol, smokes, or has diabetes, they are also at a higher risk of developing hypertension. If someone has a high intake of sodium through salt or any other source, their chances of developing hypertension increase. Compared to females, males are more likely to have blood pressure, so they are at a higher risk of hypertension. If there is a family history of blood pressure, then they are also at a higher risk of developing hypertension. If someone has an issue with obesity or leads a sedentary lifestyle, such as sitting at a desk all day without physical activity, without exercising, they are also at a higher risk of developing blood pressure. If someone is under stress, facing anxiety or depression, they are also at a higher risk of hypertension. Now let's move to the pathophysiology. The normal blood pressure of our body is maintained through four mechanisms. One is maintained by the nervous system. The second is through vascular endothelium. The third is through the renal system, that is the kidney system. And the fourth is through the endocrine system, via glands. Now let's come to the clinical features. In clinical features, I will tell you that sometimes no symptoms appear. And if a person suddenly has blood pressure, it can lead to a heart attack and the person may die on the spot. That is why it is called a silent killer. It is not necessary for symptoms to be visible in a person. If you observe this figure carefully, it shows that the person is experiencing a heart attack due to hypertension, and you can see their heart. In this figure, you can see the heart muscles and the blood vessels in it. This is one wall of the blood vessel, and this is the other wall of the blood vessel. In this, you can see yellow color fat accumulated, and in the middle, you can see blood circulating within it. Due to the accumulation of this yellow fat, the chances of blockage have increased. If this fat, that is cholesterol, increases, if it causes a blockage, then the blood vessels carrying blood to the heart won't be able to deliver blood to the heart, due to which the person will experience intense pain in the heart and may also suffer a heart attack. Now let's move to the symptoms. If someone has hypertension, what symptoms will appear in the person to indicate that they have hypertension? The first condition is severe headache. The most prominent symptom is intense pain in the head. Vision becomes blurry. There is a problem with vision. Difficulty breathing starts. A lot of pain occurs. Chest pain occurs. Additionally, the heartbeat becomes irregular. It is not normal. In urine, when urinating, blood starts appearing. Pain starts in the chest and neck. Now let's move to diagnosis. If someone has hypertension, how will we diagnose it? Confirming that they indeed have hypertension. First, we will take a history. If there is anyone in the family who has hypertension, like parents or siblings, then they also have a higher chance of getting hypertension. If someone has diabetes, they may also develop hypertension. After that, we perform a CBC, complete blood count. A blood test is conducted. Chest X-ray is taken, and ECG, electrocardiogram, is done. From all these tests, we find out whether they have hypertension or not. Now let's move to management. If someone has hypertension, what is the management for it? What is its treatment? The first thing we do is lifestyle modification. In lifestyle modification, what happens is, first thing we do is to reduce their weight if it has increased. If they consume alcohol, we make them quit alcohol. We make them exercise daily for 1 to 2 hours daily. They should walk, run, go to the gym if they want. Exercise is essential. If they are under stress, they should manage their stress and eliminate their anxiety. The second way of management is pharmacological. We give some medications. Doctors say that if anyone has hypertension, we give them medicines from 4 categories. Either they are diuretics, or beta blockers, vasodilators, AC inhibitors, or calcium channel blockers. Now, how these medicines act in our body, how they maintain blood pressure. As I told you before, these four medicines affect one of the mechanisms or activate one mechanism through which the normal blood pressure of our body is maintained. Today's question is, what is another name for hypertension? Only a genius can answer in the comments below.